Hi there, we are back with certified homeopath Melissa Crenshaw to share the best homeopathic remedies to have on hand for sinus issues today. So welcome back, Melissa.
Thank you.
Yes. Quick disclaimer that we're not medical doctors and not giving medical advice here, but Melissa has been helping families find freedom and joy for more than 20 years by teaching them how to take control of their health care. And her website will answer most of the questions you might have run through your mind as you're watching today, whether you're looking for some free printables. I know she has some flu guides and allergy guides that you can use as self-help guides, or if you want to learn more and take a homeopathic class, or if you have an acute or chronic issue that you need some help with and want to schedule a consultation, then you can do that on her website. So go to melissacrenshaw.com for any of that. I've signed up for your virus class coming up, Melissa. I'm so excited.
That's going to be so fun. That's going to be a lot of information.
Yes. You want to tell our viewers real quickly what it is and how they can sign up?
Yeah, we're going to do 30 remedies. And, I named it New Old Viruses. So if you go to my website, go to courses, you'll see new old viruses and post-viral fatigue. We're doing COVID remedies is what we're doing, and post-viral fatigue. So it's 30 remedies for COVID and viruses, acute viruses, and post-viral syndrome, 9 remedies for post-viral syndrome. I'm probably going to add quite a bit to that. We're going to have discussions and get your questions answered, and then you'll have access to the recording afterwards, so forever. So it'll be recorded.
Listen, and you'll hear something new every time, probably.
That's right.
And this is good for new people that are new to homeopathy, or if you've been using homeopathy for a while. I know that you're going to distinguish why to choose one remedy over another remedy and how often to use it.
That's right. So if you're brand new to homeopathy, we're going to go through basics too. Yeah, okay, so you won't be left out.
Yeah. It's a great deal. So be sure to check that out. I'm excited about it.
Thank you.
If we haven't met yet, my name is Carrie Wagner, co-founder of TapRoots, where we offer natural alternative medicines, mainly to improve sleep, lower anxiety, and reduce pain, and so much more than that. But we have remedies for babies through adults and even your pets. If you're out of town, visit us online at taprootsva.com. Let's talk about sinus issues today, beginning with a sinus infection. So if somebody knows that they have a sinus infection, is there a protocol that they can follow?
Yes. So the Banerjee protocol for sinusitis is Sanguinaria 200 mixed with Belladonna 6C. And so that means taking it together at the same time. And you can do that every 3 hours if it's very severe, or twice a day if it's not very severe. And you can try that I would try that for 72 hours before deciding if it's working or not. And then if it's not working, then you go deeper, right, into symptoms, and how it's presenting in yourself. And in my mentorship program, we do a whole session on sinusitis. Oh, so I go into great detail about how to treat sinusitis and what to look for. Like when I'll give you one quick little tip: when it's thick, Cali Bic. And that's just a little rhyme that you can remember.
Yeah.
So if you've got the really thick mucus, you'll think of Cali Bic. And that's, of course, after the Banerjee protocol. If that's not working, then Cali Bic is #1 for sinusitis. So that's that thick, ropey, stringy mucus. We talk about really fun stuff here within homeopathy. And it might even be so thick that it can't come out. And so that would be Cali Bic. And I would do a 200.
Okay. That's what I was going to ask. You knew. Okay, perfect. That's a great tip. I know we won't dive deep in here today, but we'll run through some of the sinus symptoms in a couple of minutes just to see if we can get some overall suggestions. But if the person is dealing with chronic sinus inflammation, how would you handle that?
So that would be Thuja. And some people say Thuja, Thuja. And I would do a 30C once a day. And, you're going to do that for probably weeks, if not, 8 to 16 weeks, and then see, if it's helping, if you have less. So chronic sinusitis is most likely going to be addressed with Thuja. You could also just use Cali Bic. That could also work.
Okay, so if they have the chronic issue going on, they're doing Thuja, and then let's say they have a flare up, are they adding in Sanguinaria and Belladonna to see if that helps clear it up faster? Or
Good, very good question. Yeah. So, yeah, you could just add the Sanguinaria and Belladonna, or you could pause the Thuja and go back to it when you're through with the acute
okay.
problem. Mm-hmm.
Okay. All right. So let's run through each symptom of a sinus infection, because one person might start with just one or two of the symptoms. And I want our viewers to have a better understanding of how to tackle it from the onset to hopefully avoid or lessen the rest of the symptoms. So let's say the person just starts with a runny nose. What would you do?
So I would always, in all acute situations, I teach all of my students this. I learned it from Joette Calabrese, just to give her credit. It's been an absolutely amazing tool. Aconitum napellus 200 mixed with Bryonia 200 every 3 hours at the very first onset of an acute condition. So that's cold, cough, flu, stomach virus, whatever it is. So that's where I would start, even if there's just a runny nose. And you don't know what it's going to be. You don't know if it's going to be a cold, if it's going to be a flu, if it's going to be a COVID, if it's going to be, sinusitis. Just do the aconite bryonia first.
Okay. And how often would you do that, and how many times before you say, all right, I need to switch it up?
I would do it. I would do it every 3 hours, and I would do that for 48 hours before deciding if, 24 to 48 hours.
Okay.
Before deciding.
And if the symptoms start changing in those 24 to 48 hours, would you continue with that or target it?
Yes. So when you see changes, you're on the right track.
Okay.
So keep going. If things have stayed the same at the end of the 24 hours, then you need to change remedies and look at what's presenting specifically. So then specifically, if the aconite and the bryonia don't help the runny nose, then if it's a watery runny nose, we're looking at Alium, Cepa, or Nat-Mur. If it's a thick runny nose, then you might look at Cali-Bic or Cali-Mur. Cali-Bic is the green yellow thick, and the Cali-Mur is the white or clear thick.
And do you usually start with the 200s?
I do. I like 200s in acutes.
Okay. And if they start with more of a stuffy nose, what would
that one really is hard, because if you're just feeling stuffiness up there, if nothing's coming out, then Cali-Mur might be the best place to start. If something's coming out, then you're looking at the color. So that, again, the yellow green is going to be Cali-Bic or maybe Pulsatilla, or possibly Hepersulf. All of those are yellow. And then the white or clear thick is Cali-Mur. And then the runny, watery is, again, Alium, Cepa, or Nat-Mur. So it just, I know stuffy usually means it's not really coming out. But if you can blow and something comes out, you look at the color and the consistency to decide.
I can say the last time I remember having a stuffy nose and I could feel the congestion in my ear, and I did Cali-Mur, and I only had the 6X on hand, and I took it every 15 minutes, and very quickly I felt relief.
Wonderful. That's great.
Yeah.
Yes.
So good. So what about the facial pain or pressure or headache?
Ooh, yeah. So Sanguinaria and Belladonna mixed together are so the Belladonna piece of that is the pain, the headache and the facial pain. But so then if we've moved past that and the Banerjee protocol isn't working, then Mercurius, Merc Viv or Merc Sol is for that, is great for that facial pain.
Okay. And what about the sore throat? Is that also going to be your Belladonna?
Yep. So Belladonna is beautiful for sore throat. So if we've moved past that and the Banerjee protocol is not working, then Merc Viv is my favorite for sore throat.
Merc Viv. Okay. Okay. Let me ask you your opinion on this. I haven't asked you this ahead of time, but I know I personally love this, especially for new people that might be new to homeopathy and aren't sure where to start. This one has Belladonna 3, Sanguinaria 3, and Spigellia 3 all mixed together. Have you ever used this, or what do you think of this? That's
Sinus Calm, right? Yes, I love it. Yep, I absolutely love it. Yes, especially for, like you said, people that are brand new to homeopathy, don't know what it is. That makes it easy. and it works. So that's what I did actually with my husband the last time he had a sinus issue. I didn't just go Sanguinaria, Belladonna. I was just like, here, take, because he had a box with him. He could take it to work.
Right.
You know, it was easy. It was in the little blister packs. It was easy for him to take. And that it's all we ended up using was that right there. I forgot about Sinus Calm. That's a good one.
Oh, I love it. Yeah. The directions on this one, you just take 2 tablets under the tongue every 2 hours, depending on.
Actually, I lied. We used that, and then we ended up adding something else as the symptoms changed. I'm just picturing the dresser next to his bed, his side of the bed. There were several different remedies we kind of went through. But anyway, it's a good one.
Right. Okay. Well, I know we could do an entire interview on cough, and we really should sometime. But if a cough develops, you know, and thinking about sinus infections, is there a certain remedy you typically see used often?
It depends on so many things. If it's a dry cough, you might think Bryonia. You know, if it's a gagging cough, then you might think Ipecac. Because sometimes with the sinusitis, if it's the mucus is going down the throat, if there's postnasal drip and it's gagging you, then you'll think of Ipecac. And of course, that's homeopathic Ipecac, not the not the thing we used to buy over the counter. But you know, I lost what I was going to say. That I have a podcast. I have a podcast and a blog post on coughs that so many people have said has been very helpful. So you go and listen to that, and I describe in great detail the different coughs and how to choose and what to do. But yes, Heparsol is also great for coughs.
Okay. I'll have to look up that blog post, and maybe we could email that out to our customers. That would be very helpful. Which remedy would you use if your sinuses are bleeding?
Ooh. So I would still do the Sanguinaria and Belladonna. But I might add Ferrum Phos if there was quite a bit of blood. But if there's pouring blood, that's different. I don't think that's what you're talking about. Blood-streaked mucus is common with sinusitis, and that would, again, still be the same kinds of remedies, and maybe add Ferrum Phos if it's quite a bit of blood. Okay.
Well, as a bonus, if you know this off the top of your head, for people that get frequent nosebleeds, is there a certain remedy?
Phosphorus, So Ferrum Phos has the phosphorus in it.
Yes.
Yep.
That's amazing.
Yeah, so good.
Okay, good. What if the person loses their taste and smell like so many have been?
You did ask me that ahead of time. Oh, sulfur. And sulfur has been known to work. Sanguinaria, I believe, has been known to work. Pulsatilla, I've seen work. Ooh, I have a note right here.
And all 200s you would do?
Yeah. So sulfur, I'd probably do 30 once a day. And you might be doing, so some people I've known to do sulfur 30 once a day. And, you know, maybe they do it just a couple of doses and it comes back after. And they were like, I've been without my taste and smell for months. And they took a couple doses of sulfur and it came back. Or you might have to do it longer. You might have to do it a week or two, but I wouldn't stop. Just keep going with the sulfur. Yes, Sanguinaria 200, I have a note here, is great for that. And I have some people have had great success with Pulsatilla.
Okay. So with the taste and smell, how long should they give that remedy before saying, I'm going to switch from sulfur to Sanguinaria?
So if it's acute, so if it's new, they've had it for less than 4 weeks, then let's give it a few days, you know, to maybe a week. If they've had it more than 4 weeks or more than 3 weeks, then that's chronic at this point, and you need to give it a couple of months. And hopefully it won't take that long, but I would say 2 months, and then if it's still not back, then change. And I have seen people, even on homeopathic remedies, take a couple of months for it to still to come back. There would be like a little bit like, oh, today I can smell eggs, right, or taste the eggs, and you know, and then that was it, and then it just kind of slowly comes back.
Okay. What can be done for allergies that mimic a sinus infection?
I used to do that all the time, Carrie, when I used to have such bad allergies, and then I would be so miserable, and they would be so bad that they would turn into a cold and sometimes a sinus infection. So right when the allergy symptoms start coming on, my allergy protocol is amazing. Alium, Cepa, Calimere, and Apis. Yes,
Yes.
200, each 200. And I would do that as needed for the allergy symptoms. You have something, you have Histaminum, but you also have RhinAllergy.
RhinAllergy, yes.
Yeah, that might
That's
be
been,
good to get it in the beginning. So then,
mhm.
but what I think what you're asking is now it's going on, it's gone past that point, and it
Mhm.
has turned into maybe a sinus infection. Then you're still looking at the same remedies: go
Right.
Sanguinaria, Belladonna,
Mhm.
you know, Pulsatilla, whatever, you know, however it's
Okay.
presenting.
We'll have to do a future chat on uprooting those allergies.
Yes,
Yeah.
yes.
Okay. What about children with a sinus infection?
So all the same.
Hmm.
That's the beauty of homeopathy, that we don't have to tweak it for children or
Hmm.
elderly or weight or, you know, what medications you're on. What you use for a baby, for a toddler, for an adult, for a pregnant mom, for a breastfeeding mom, for an elderly person is the same, all the same. And then the same for your pets. You use the
Right.
same remedies.
Yes. Yes. We
Hmm.
get customers asking about pet
Hmm.
allergies too. So
Yeah.
you definitely need to do an allergy one. If you're out there watching and you are like, oh, I wish they would talk about fill in the blank, message us.
Yeah.
Comment below, privately message us. Let us know what it is you'd love us to cover,
Hmm.
because we love doing these interviews with Melissa, and this is free information for you. So take advantage of it. If you found this video helpful, please do give it a thumbs up, share it. Thank you, Melissa. We
Thank
appreciate your
you.
time.
Thank you. You're so welcome. Good to see you.
Yeah, you too. Well, make sure you visit Melissa online at melissacrenshaw.com. You can visit TapRoots in store in Lynchburg, Virginia, or online at taprootsva.com for your remedies. And we will see you next time. Bye.
Bye.